Hello and welcome again to another presentation. We've got Group 8 here. They're going to be talking about Medicaid and Medicare. I think this is one of those important topics that we all know a little bit about, but probably not a ton. So this will be a great presentation. So I'm just going to turn the time on over to them. Take it away.
So like Brother Gage said, we're going to be talking about Medicare and Medicaid. Next slide. And some of the topics that we're going to be discussing today is the history of Medicaid and Medicare, the beneficiaries, the component parts of Medicare, the federal and state specific issues of the two programs, how they are funded, and what the Medicare Trust Fund is and when it's projected to become bankrupt. Next slide.
So the history of Medicare and Medicaid started way back when, before you even would think about it starting. The history that I did research on even kind of brought it back to the Civil War when there was a pension plan back then. So it's kind of interesting, but it's really been since 1912 when President Roosevelt tried in his political platform to include this kind of health insurance. And then in 1935, the Social Security Act was established and included federal assistance for Americans 65 and older. And especially during 1935, this was during the Great Depression, and the elderly people became very poverty-stricken, and more than half of the elderly lacked means to be self-supporting. Next slide. So in 1945, Truman envisioned America having health coverage that would pay for doctor's visits, hospital visits, laboratory services, dental care, and nursing services. They tried and tried, but the bill didn't go through until 20 years later. Next slide. So in July 30th, 1965, President Lyndon B. Johnson signed the bill for Medicare and Medicaid. And in 1996, more than 19 million individuals were enrolled at an annual cost of $64 million. Next slide.
Okay, so let's talk about some of the beneficiaries of Medicare. They include senior citizens age 65 or older who have been legal residents of the United States for at least 5 years, disabled citizens under the age of 65 who also receive Social Security disability insurance or Railroad Retirement Board disability benefits, citizens on dialysis treatment for end-stage renal disease, or citizens that need a kidney transplant. And it's estimated that about 55 million Americans are covered in Medicare for 2015. Next slide. The beneficiaries of Medicaid. These include people with income up to 133% of the poverty line. It also includes low-income people, including families, pregnant women, children, citizens with disabilities, adults with dependent children, and the elderly. You must be a U.S. citizen to receive Medicaid benefits. CHIP is an acronym for the Children's Health Insurance Program. It's also an expansion of the Medicaid program and covers children under the age of 19. It's been estimated that 70 million Americans were covered in Medicaid in 2015. Next slide. I found this slide interesting. I found it on the internet and wanted to include it in our presentation because I didn't fully realize that you could have dual coverage with both Medicare and Medicaid. Although this data may be a little bit outdated, it stated 2008, it shows that roughly 10% of people back then were dual covered in both Medicare and Medicaid, and that still exists today. Next slide.
So this next slide is the four component parts of Medicare, and there's A, B, C, and D. So Medicare Part A is hospital coverage. It's one of the original Medicares. You're not fully, it's not the full healthcare coverage, and you qualify when you turn 65, or if you're under the age of 65, and have a disability, or if you have lateral sclerosis. It's also known as Lou Gehrig's disease. And this one is free to who qualify for this, and it's covered by Social Security. The next one is Medicare Part B, which is medical coverage, and this is also one of the original Medicare. It covers healthcare visits, and it prevents diseases, services, and anyone who needs surgeries or wheelchairs or casts or anything like that. And you're automatically enrolled at the age of 65 if you already received Social Security. You can also decline the benefits if you'd like. And the monthly payments for this is around $104.90. And that's for the premium coverage. However, if you fail to sign up during the initial enrollment period, you may have to pay for a premium penalty for the remainder of your life. Next slide. And the next slide, it shows Part C, which is both A and B coverage. And this is a Medicare Advantage plan. Both A and B combined are both included. It's managed by a private insurance agent. If you qualify for A and B, you're eligible for Part C. You can get this when you turn 65 and when you start receiving Social Security. You can also sign up during the annual election period year, which is October 15th to December 7th. And the cost ranges from little to no added charges from your monthly B premium plan. And then the next one is Part D, which is prescription drug coverage. And there are two ways to receive this coverage. It's the Medicare prescription drug plan or the Medicare Advantage plan. You qualify if you're eligible for A and D coverage, and you can sign up again during the election period year, again, October 15th through the 7th. And this covers drugs and medications that you receive. And there's also no premium penalty for signing up for the prescription drug coverage after the enrollment period. Next slide. Next slide.
Who pays for Medicare? And it is for Medicare specifically, Part A is funded through Federal Insurance Care Act. And this is funded through your paycheck. And so anybody who is paying for Social Security and other things on their paycheck through their employee will get paid. It'll pay into this, and it's called the Hospital Insurance Trust Fund. And to receive Medicare, you have to have been working or paid into the system for 40 quarters, which is about 10 years. Medical insurance, which is acronym is SMI, is a trust fund that helps to pay for Part B, C, and D. Part B, C, and D are voluntary and have premiums that have to be paid as well, just like what Emily was saying. Next slide. Who pays for Medicaid? During the new health reform, the Affordable Care Act, more individuals became eligible through Medicaid. Like Alyssa was saying, that they have to be 133% over the poverty line, which it used to be a whole lot lower than that to be able to qualify for Medicaid. Because of the changes that were made, much of the state and federal governments it affected how much the state and federal governments pay for Medicaid. The federal government can now pay almost 93% of costs for Medicaid, leaving about 7% for each state. Some states can be eligible for 100% coverage of their Medicaid cost. And before the Affordable Care Act, the federal government would provide anywhere from 52 to 85% of the funding necessary for Medicaid. So there's been a lot of changes with the federal government paying for it, and they're making it a lot easier for individuals to be able to get onto the Medicaid plan. Next slide. The Medicare Trust Fund Act, or Trust Fund, is like what we were saying before with Part A, is funded through, and so because of the increase of baby boomers who are going to be eligible for Medicare, they're going to continue to increase, and so there's going to be more people that are going to need Medicare, and so there's going to have to be a increase as well as to how much we're putting into that trust fund. Right now, they're projecting that there's going to be about 76 million people in 2028 that'll be eligible for Medicare, and with that increase, there's going to be less money getting put in because the baby boomers are retiring. And so it's also projected that in about 2028, hospital insurance trust will actually run out of money. And so they're trying to figure out different ways to be able to keep that money there for individuals to have Medicare still. Next slide. Oh, okay. I think that we skipped a couple slides because Mao's, I believe, was before mine. And I don't know if it just accidentally skipped over that.
You want to tell me when to stop?
Okay, where is it? It's right there. For some reason, it yeah, it's right before this one. Right there.
Okay, Mal, if you want to we'll wrap it up with this one here. I'd love to hear about
Okay. So some of the federal and state specific issues of Medicare and Medicaid. So the Centers for Medicare and Medicaid Services is a branch of the Department of Health and Human Services. And it is the federal agency that runs the Medicare program and monitors Medicaid programs offered by each state. Medicare is 14% of the federal budget, and then between 2010 to 2030, the number of people on Medicare is projected to rise from 46 million to 78 million. The Medicare Part 8 hospital insurance fund will have insufficient funds to pay for full benefits beginning in 2019. And some of the other ones is controlling costs, which is Medicaid. Medicaid is one of the largest items in state budgets. Expenses typically soar during economic downturns as enrollment increases, when people lose jobs and their health benefits. So that puts states in a quandary because they struggle to keep up with higher costs as their tax revenues decline. And then getting states to expand income eligibility under Obamacare and better oversight of managed care, ensuring access to doctors and dentists, and meeting growing demand for long-term care.
Does that cover it all then? Yes.
Awesome.
Thank you very much. And that's it for you. Oh, you got 2 pages. We're excited. And is that it for y'all?
Yes.
Okay. Very good job. We will go ahead and forego the question and answer, so you're off the hook with that. But I appreciate the time and effort that you put into the presentation. You did a very good job. Like I said, Medicaid, Medicare, people are usually somewhat familiar with it, but a lot of people don't fully realize the different parts and what the different parts mean, where the payment comes from. And I can tell you from, we'll say, testing experience that things like knowing what each part of Medicare, Medicaid does, A through D, you'll see that come up in your quizzes to come. So you did a great job explaining those along with all the other things too. So thank you. I appreciate it. And I'll let you just enjoy the rest of the evening.
Thank you.
Thank you.
Have a good evening. Thank you again.
Bye-bye.
Bye.
Thank you.
Thank you. Bye.